If you wash your hands and you don't touch your face, you're not going to get this disease. And so it's very important at this point to keep your social circles small. Don't be putting yourself in a situation where you have a lot of contact with a lot of people, because it's just a vulnerability. You don't know that the person at the farm who you slapped hands with 2 days later will not have this disease, because then that means that you're going to have to socially isolate at that point even more. So the third thing that I want to talk about is something that is inevitable in a group chat that's this large, which is, what do you do if you get this disease? And this is, I think, if you listen to nothing else through this entire thing, just please listen to this part. In Wuhan, China, throughout the world, the vast majority of spread of COVID-19 is through home and family transmission. So I'll say that again. Throughout the world, the way this is transmitted is from husband to wife, father to son, daughter to brother, whatever. And so, again, that's incredibly scary, but it's also something that, if you understand the rules, is incredibly empowering. So what do you do? If you develop a fever and you are otherwise fine, and isolate yourself from your family. So what does that mean? It's just simply about the same rules about hands and touching your face. Is you don't want sustained contact with the person who's sick to the point where you're going to be able to pick this up off of surfaces or off their person and then touch your face. So what are people recommending? If you're able, have the person in a separate room. If you're able, have the person who's sick have their own bathroom. If the person has to come out and interact with people in the family, this is a perfect indication for one medical mask. And the reason is you want to put the mask on the person who's sick. And so if in our apartment, if I was sick and I had to come out and interact with my family, before I would leave the bedroom, I would wash my hands, I would put on a mask, and then I would go out and maybe I would sit down and eat food at the table. And then after that, when I was done, I would eat the food, I would put it in the sink, I would make sure that anything I touched, which is a very simple area on the table, is just washed, and then I would go back to my room. And so the point is to not have sustained contact with someone in your home who has this disease. You're gonna wanna take care of them. You're gonna wanna be in and out of there. How are you doing? Checking their temperature. Don't do it. If you're touching the temperature probe constantly to their mouth, that is where the disease exists. And then you're going to get it on your hands, then you're going to touch your face. And so you shouldn't be scared to stay at home with your family with a fever if you have COVID-19. The vast majority of people are going to have a fever, body aches, feel like shit for 3 to 5 days, feel a little less shit on 7, and then they're going to start to feel better. You can start interacting with your family more as you feel better, as your fever is gone, but you're still going to be vigilant. You're going to be washing your hands. You're going to be a lot more confident 20 days out from the disease than you are 10 days out from the disease. The current recommendation from the CDC is that if I get sick and if I'm feeling better, I can put on a mask and go to work. And so I think that that is a good indication to you that that's when you can start interacting with your family. Is that if you have COVID and you've recovered and you've isolated in your room for 7 days and you've been able to get food, and when you've been with your family, you've worn a mask and you're feeling better, come back out to your family's life, keep a mask on and wash your hands. And so I think that that is a very simple way to do it. I'm about to get to questions. I just want to make a few other small points because this is some stuff that's come up that's relevant in New York City. What do I do if I have a mild cold? And so I think given how rampant COVID-19 is at this point, I think if you have something that feels like a cold or you feel like you're getting sick, is take the precautions like you have COVID-19 for 1 to 2 days. If in 1 to 2 days, you're feeling much better, and this is like the 1,000 other colds that you've had in the past year because you have kids, you don't have COVID-19. and then you can go back to your completely normal living at home life with your family. So I think it's just important. The place we get into danger is people being too cavalier when they're developing symptoms and exposing their family too early. And then when they get fevers and they're staying at home, is that they're having too much interaction with your family. You can have COVID-19 in your house and everyone else not get it and be protected and be completely safe. There are a couple exceptions to that, and I think this is important. If you have a vulnerable population in your family, so if you're living with your lovely 95-year-old grandmother, if there's someone in your house who had recent chemotherapy and someone in the house gets sick, you need to find another living arrangement for that patient, or practice incredibly strict isolation of that family member. We know that the older population is the sickest population when they get this disease. And so that is the one caveat to it's safe to stay home with your family, is if you have someone who's incredibly vulnerable, you need to set up a situation in the house where they're completely isolated from the person who is sick. Maybe you could have another person take care of that family member in your house so you have no interaction. But simply being in the home with someone with COVID-19 will not get you that disease. It goes back to the same three principles. It's touching a person or a surface who has COVID-19 and then touching your face. And so lastly, for this, before I get to some of your questions, is when do you go to the hospital? And so I think probably the question that a lot of people are asking is, if I get COVID-19 and I feel short of breath, am I just going to go to the hospital and die? This is where I'm probably the most qualified person in the country to comment on what it looks like when people are coming into the hospital and sick. So first, who should go to the hospital? If you're feeling short of breath, come to the hospital. That is the rule. That is the clearest thing. It's not, I have a fever. It's not, I think I have COVID-19. It's not, I can't stop having those body aches. It's, I feel short of breath when I get up to go to the bathroom. Those are people that should come to the hospital and be evaluated. At Cornell right now, what we're doing is a lot of the people that come to the emergency room, we're sending home to live out the 4 or 5 days of their disease so that they can feel better. And we say, oh, you look completely fine, go home. But what we're also seeing is that people that feel short of breath, who come to the hospital, some of them go onto the floor and just are short of breath for 5 to 6, 7 days, and then they go home. So of the entire population of people who get COVID-19, about 10% need to go to the hospital because they get short of breath. Of the 10% who are coming to the hospital, about 1 to 2 to 3% of those are requiring admission to the ICU and to be put on the ventilator. So what happens when people get put on ventilators? The vast majority of people, overwhelming majority of people, come off the ventilator. And they usually come off the ventilator 7 to 10 days later. But I think the important thing for you guys to know is going to the hospital is not a death sentence. It's a safe place for you to be. Go to the hospital when you're short of breath. Don't go to the hospital just because you have COVID-19. And then I think the question that we're going to get a billion times over, and I don't have a perfect answer for you at this point because it's different in every community, which is, should I get tested if I have the disease? If I'm a generic 35-year-old who's sick, I think it depends on the availability of testing in your community. What we know right now that people are home, is that if you have, and not having a lot of social contact, is that if you have diseases if you have symptoms like the flu, it's likely you have COVID-19. And nothing that I've told you about behavior, about interacting with your family, a lot of that stuff would change by knowing that test result. The caveat is if your community, whether that's New York or Tennessee, is testing a lot and you have clear access to testing, absolutely getting a test is a good idea. Because when it's negative, then in a day when you're feeling better, you can have full interaction with your family. So I think that is the key. But if you live in a community where there's very rare testing going on at this point, do not try and jump the line to someone who's actually short of breath and really not doing well. just to make yourself feel better, to know that you have it. Just take the precautions in your home that I said, and then as testing ramps up, then we'll be able to get more people tested.